Hi, it's Jeff Murray here from Ambition Health and Performance. Today I'm going to put together a short video on how to improve your balance. Now, we can end up losing our balance for a whole myriad of reasons. It could be that you've had some sort of a surgery on your foot and your toe or your ankle, or you may have twisted your ankle at some stage, or you might have had a knee or a hip injury. They all seem to result in the same thing. For example, an inability to stand on one leg or to do any single leg based exercise such as a lunge or a single leg squat, a lunge, pistol squat, anything at all. It is quite a tricky area to overcome. Doing the exercises, you've really got to focus your mind onto what's going on with your body. So it is quite tricky, and it can be caused, as I said, for a myriad of reasons. So I shall now run through how you should start to progress these types of exercises. Okay, thank you. So I've got a chair here for those of you who are really struggling with balance. You can have your hands to the front, so you've got something to hold while you start to do this. So to begin with, we look at single leg balance, standing on one leg. And what we think about here is having our shoulder over our hip, knee and the ankle, so everything in alignment. So I'm showing you from the side here, you can see clearly how we can use the chair. If you lose your balance, you can place your hands back onto the chair, okay? So that you don't twist your ankle. However, you need to have a look at what's happening here from the side. So ankle, knee, hip alignment. So what I'm trying to do is maintain alignment all the way from my ankle through my knee to my hip to my shoulder. Now, for full disclosure, and some of you who know me will have heard about this, engage the glutes please. I did have a fairly serious accident 2 years ago, and I struggled to walk for about 9 months, and I was left with serious balance issues, and I couldn't stand on this leg for more than a couple of seconds. So now I'm able to do this for a minute. So you notice I said engage the glutes. Well, engage the glutes, yeah, great. Engage the core, great. Engage the calf muscles. Get your mind into tightening up in the calf muscles. And imagine your feet have suction pads onto the floor, and they are sticking to the floor. So don't scrunch your toes up. Try and suck your feet onto the floor. So this, what you're seeing here with me, is in a very, very badly damaged ankle and with an enormous cyst on the back of my leg, and I have managed to sort this out. Okay, so that's single leg balance. Same on the other side. If you are a novice or struggling with this to begin with, don't twist your ankle, don't swing around like this. Have a chair there, and here's my, which at one time prior to twisting my right ankle was my trickiest side, but I could stand on this left side all day. And we think about ankle, knee, hip alignment. So you may see some misalignments in me. I did have a bad fall down a mountain, but I'm doing okay. So we have single leg balance here. So I talked about engaging the core. Yes, we've got to engage the core. The best thing to think about is to draw the navel into the spine and brace, okay? Both things, navel towards the spine and brace and tighten the abdominals. Of course, it's only to maybe 20-30% intensity. We're not holding our breath or crushing our abdominals in there. The gluteus medius on the side of the hip has a lot to do with all of this. So if the glute med isn't working, you can tell if someone stands on one leg and you see this happening, you know glute med's not working, so that needs to be pulled in. Now, easier said than done. I often give a side-lying leg raise, amongst other things, to those I work with. So we're simply raising the leg up to the side, leading with the heel, and getting the gluteus medius working on the side of the hip. Take care not to be bringing your hip forward for this exercise. That is training your TFL and your hip flexor, so you need to be lifting the leg up laterally to the side to be targeting the glute med. And the way I find it best is just to lead with the heel, as you can see here, and coming straight up. And if you're worried about flexing the hip, take the leg slightly behind you, just ever so slightly behind you, but we're not rotating our spine or our hips. So that is a good way of activating and getting the glute med stronger with an isolation exercise, which you can then use on your single leg exercise in an integrated movement like single leg squat. Additionally, I would also recommend a little bit more here than I anticipated doing. Getting into a floor hip extension, all about engaging the glutes. Squeeze them nice and tight. So the extension all occurs from the butt, okay? So that is a starter way to get things working for you. Now, once we move on from the single leg balance, we start to think about a great exercise called clock touches. So there's the single leg, so now we can balance without the chair. There's 12 o'clock, there's 3 o'clock, there's 9 o'clock. Oop, loss of balance, see, it happens. Back to 3, back to 12, back to 3. So we can select different numbers on the clock. There's 2, there's 5. You can see the response there, so I'm trying to respond to the given instability. And it's pretty good for you to see me doing this, because I have really struggled since I had my mountaineering accident. But you can see now it's not bad, and you can see this is a very good exercise for me because I'm working my right leg through a different plane of movement. There's extra challenges going on. So 1 minute there, then on my right leg, which I struggle a bit with. There we are. Same thing, except it's a different clock here. It's midnight, it's 9 o'clock, it's 6 o'clock, and you can see the same thing going on, this lateral shake from side to side. However, I'm handling that quite well for the purpose of the video, thank God. Well, there we go, glute med, please, come on, core engage. Now, I promise you, if you do practice these exercises and everything else being equal there, you will start to make improvement with your balance. You do have to be patient. If you do need or require further help, just please message me or send me an email anytime, and we'll be happy to help with a virtual session, or when we open again, maybe see you back at the clinic. Many thanks for listening. Thank you. Bye bye.